Welcome to Local Health Department Contract Training. This module is on core contract training. The regulation that pertains to the local health department contracts and the financial management requirements are found in 902 KAR 8170, Section 7, Contracting for Services. This states that the contract is between the local health department, LHD, and the contractor, provider, and should be signed by both parties prior to July 1 each fiscal year to ensure no interruption of services. Technically, if the contract is not signed by July 1 by both parties, there is no effective contract in place. Services should only be provided once both parties have signed the agreement. Subsection 10 of Section 7, 902 KAR 8170 states that all local health department contracts and contract amendments are subject to review by the Department for Public Health. We will now begin a description of the various contract templates and their purposes, beginning with the CH50 contract. The CH50 template was created for contracts related to minor object codes 180 through 189 under General Ledger Account number 573 as detailed in the Financial Management section of the Administrative Reference. Please review contracts for provider numbers 18 to verify usage of the appropriate template. CH51 contracts, or Local Health Department Employment Contracts. For questions and concerns related to contracted employees, please contact the Local Health Personnel Branch at 502-564-6663, option 5. CH51 Personal Service Contracts. CH51 contracts should be used to fill positions not available in the local health merit classifications. All CH51 contracts will be reviewed by the Local Health Personnel Branch prior to execution. Positions in the below programs will be allowed to contract when requested: home health, the HANDS program, school health, and first steps. The employee contracting regulations related to CH51 contracts are from 902 KAR 8170, Section 7, and state, a health department shall not use a personal services contract to substitute for establishing a position in the local health department. A health department shall not contract for personal services with an individual who works 1,200 hours or more in a year, except with Department for Public Health, DPH, approval. All CH51 contracts are to be sent to DPH for review to determine if DPH approval is needed. Some merit positions may be approved for contracting if they are time limited or another unique situation. Approved CH51 contracts that exceed 1,200 hours per year or demonstrate a trend of 100 hours per month shall have benefit costs of retirement and health and life insurance. If a retiree that participates in the Kentucky retirement system and works 1,200 hours or more per year, either fiscal or calendar, the LHD shall pay into retirement, but not the employee. All retirees returning to work should check with KRS before the start date. Multi-agency contracting. An agency employee shall not enter into a contract with or hold an additional full-time or part-time position in another agency unless approved by the Cabinet in writing. If an employee contracts with multiple agencies, the total of all hours worked will be reported to KRS, and the employee and agencies may be subject to retirement and insurance contributions. A contracted employee or merit employee may be subcontracted by their agency to work at other agencies. Guidelines for employee contracting. Complete the application process. Send the application to local health personnel and/or the program lead at the Department for Public Health for program-specific qualifying. Obtain all contract employee signatures for required documents. Send all independent contractor contracts to KRS for review, if with an individual. Contact local health personnel branch with any questions. CH-52 contracts. The CH-52 contract type was created by DPH to provide a standardized template that local health departments may use to enter into a contract with a public or private entity to provide needed health services. The CH-52 is used for agreements between local health departments and boards of education, Payer Code 8 agreements, and contracts between two local health departments. When two health departments contract for the services of one employee, the health department requesting the services is the health department that should write the contract. In this instance, the first party is the health department that is requesting the employee, and the health department is the health department that is supplying the employee. This is for the purposes of filling out the contract template. CH-53M contracts, local health department independent contractor agreements. The CH-50 contract template shall be used to enter into contractual agreements with independent service providers. In conjunction with the CH-53M, it is sometimes necessary to have a CH-55 document, the Medicaid Statement of Authorization for independent contractors only. If the contractor is performing services on site and the local health department will bill Medicaid on behalf of the contractor, the CH-55 form is required and shall be included in the CH-53 form after the signature page. The contract shall have an N at the top of page 1 in the appropriate area of the contract template. The Division of Administration and Financial Management strongly recommends, if the contractor is a Medicaid provider, that the contractor bill for the services performed off-site. The CH-55 form is not required in these instances. So, if third-party billing is the responsibility of the contractor, the CH-55 form is not required. If the local health department contracts with a contractor and the local health department will be providing third-party services, third-party billing services. This includes patients that are provided services by the contractor at the contractor site who have insurance, Medicaid, Medicare, etc., with the exception of laboratory services. And for CPT codes not listed on the Department for Public Health Medicaid Preventive Fee Schedule, the local health department will not receive payment from Medicaid for these services. If the CPT codes are not billable by local health departments to Medicaid or other third-party plans, the local health department should not agree to bill on behalf of the contractor. If the local health department is responsible for billing the third-party payers, the contractor shall not bill third-party payers. Payment information related to CH-53M contracts. Without a need for an amendment, the total amount of payments detailed on the CH-53M contract may be up to 20% greater than the contract total, which is typically listed in number 1 on the payment information page of the contract. In the example below, we see that this payment was the payment made under the terms of each section of this contract shall not exceed. We see that the total there is $20,000. But in section 2, it takes into account the 20% difference. Laboratory services provided under CH-53M contracts. Independent contractors shall be responsible for billing all third parties for laboratory services. This is for provider numbers beginning in 201 for pathologists and 250 for laboratories. Supplemental reporting of CH-53M provided services. When the contracted provider bills third-party payers, there are some services that DPH program requests local health departments to report through the supplemental reporting system to obtain necessary federal and state data information. Some of these services include mammograms, breast ultrasounds, PAPs, HPV tests, lead tests, and so on. The supplemental reporting document, CH-47, is to be used to report these services and may be found on the Local Health Operations branch webpage. If a contracting medical professional is a governing board of health member, then an automatic exemption to the conflict of interest provision of the contract policies is made if the annual amount will not exceed $10,000, subject to 902 KAR 8170, Section 7, 6A, 4B. Contracts which exceed $10,000 with Board of Health members must be approved by the Commissioner of the Department for Public Health. A letter of justification indicating the necessity and rationale for contracting with a board member must be submitted to the Commissioner's office with the proposed contract. The CH-54 contract template. The CH-54 contract template shall be used for entering into contract service agreements for local health department audit purposes. CH-58 contracts. The CH-58 contract template shall be used for entering into service agreements for local health department taxing district audits. Lease agreements. DPH provides a standard lease agreement document for use by local health departments. Templates. Current templates can be found on the L drive under the LHD contracts folder in the folder appropriate to the pertinent fiscal year. This is also where you will find training presentation materials, program-specific boilerplate language, and program-specific rate grids. If you have questions or concerns related to developing contracts, please contact Local Health Operations Branch at 502-564-6663, option 1, or localhealth.helpdesk@ky.gov.